Head nurse Jo and head doctor Selva start another 12-hour shift in intensive care, caring for 13 of the sickest COVID patients. Even the most experienced staff find it stressful.
The support that they give each other, the camaraderie really sort of is getting them through this, because it is quite a harrowing experience. It's not normal intensive care nursing.
Intensive care is just the tip of the iceberg for Kettering. They have 174 COVID patients across the whole hospital. That's 1 in 3 of the patients here, and that's likely to go up.
It does take a toll on both our physical and our psychological well-being. We are all humans at the end of the day, so we are trying to do our best, trying to cope with all this additional pressure and strain.
It's the basic things. Staff told me they're often thirsty. They don't drink much before shifts because you can't take a toilet break in full PPE. Nurses and doctors have been drafted in from other parts of the hospital to help because 1 in 5 staff are off either sick or self-isolating. Jo, the end of another long shift. Can you just look into the lens? What's the one thing you'd like to say to people?
Okay, you've seen what it's like for us working 12.5-hour shifts in full PPE. I'd like you to keep safe, do the right thing, follow the rules, stay at home, only go out if you absolutely have to, and then ensure that you are social distancing, wearing a mask and washing your hands, please.
Those are the very sickest patients, but in a nearby ward, dozens more are suffering. Louise is trying to juggle the daily influx.
In here, it's literally 1 in, 1 out. We're seeing a younger demographic than we saw in the first wave, with patients 22, 24, 32, 47, which is a lot younger than we were seeing in the first wave. And mothers and sons, daughters, etc. So family groups, and that have had contact with each other at Christmas and New Year.
So it's really obvious that people who've mixed on Christmas Day and across that holiday.
Yeah, they're the ones that are coming in now.
Kettering General's at full stretch. Staff are exhausted and it's likely to get worse. Staff here say that the patients are getting younger and younger. So the average age now is about 59, and in there is 59-year-old Daniel. I'm about to get kitted up and go in and talk to him. It's not quite as much as intensive care, but we still need protective clothing. And each patient has to sit inside their own tent. Hi, Daniel.
Hello, Richard.
How are you feeling?
I'm a little bit better now. It's not very nice. It's when you try to catch your breath. You want to breathe and you can get a breath to there. And then people think it's not real. It's there. It definitely is. And it's mindless people just walking about, mingling when they shouldn't be, when they say stay at home, stay at home.
Well, thank you so much for talking to us. I'm going to let the curtain close now. You're living in this curtain for the time being. Yeah. We wish you all the best.
Thank you very much.
Richard Westcott, BBC News, Kettering General Hospital.